Hello, my name is Dinesh Pubbi. I'm one of the electrophysiologists. I am a cardiologist and I subspecialize into the heart rhythms. We're going to talk about atrial fibrillation today. Atrial fibrillation is the most common arrhythmia in the United States. You heard about people talking about fish flip-flopping in their heart. You heard about people saying, hey, I got some palpitations. You heard about people saying, hey, I don't feel good today. Some people say, hey, I feel dizzy. Many times when you ask the people, they say, hey, I feel some rapid heart rate, I feel some irregular heartbeat. Differential diagnosis, which means one of the possibilities could be the atrial fibrillation. 1/3 of the people above the age of 65. So that means 30% above the age of 65 and almost 40% above the age of 75 can have atrial fibrillation. So you need to ask your doctor first of all, Doc, can I have the atrial fibrillation? And you don't have to have atrial fibrillation all the time, it can come and go. Sometimes you feel the irregular heartbeat, sometimes you don't. You may go see the doctor and may say, hey, your EKG looks good today. Does not mean you don't have atrial fibrillation, it can still come and go. So always ask the cardiologist or your electrophysiologist to do some further testing if you suspect atrial fibrillation. Main thing you worry about atrial fibrillation is not just the name, that it is the irregular heartbeat where your heart goes out of rhythm from the top chamber. But the main thing which bothers is that it increases your risk of stroke by 5 times. So people who have atrial fibrillation today and one of your friends who don't have it, but you have it, your risk of stroke goes up by straight up 5 times. In that case, the treatment may include the blood thinner, which thins the blood to prevent the clot in your heart so you don't have a stroke. That is why it's so important to diagnose the atrial fibrillation. Not just the stroke risk, but it makes people feel tired, fatigued. It can lead to congestive heart failure, makes you feel short of breath, may not be able to do your activities what you normally want to do. And that affects your performance, your quality of life, and it affects the patient sickness, cutting down the office going hours, as well as spending time with your families. Not only it can weaken the muscles of your heart, which can lead to the fluid buildup. There's different ways to diagnose the atrial fibrillation. There's different ways to treat the atrial fibrillation. I'm going to take a pause here and go to the next process of how we diagnose, and then I'm going to go into the next step where we say how we treat the atrial fibrillation.